This is the celebrity plastic surgeons of Beverly Hills.
So Reuben's a very handsome 21-year-old man, and he looks great, he loves everything about himself, but he's got a problem with the appearance of his nose.
I wanted a nose job for quite a long time now, maybe since I was 13 years old. I'm comfortable with the way it looks, the size of it, and I'm ready for that to be fixed.
Hi, Reuben, I'm Dr. Diamond.
Hi, doctor. Nice to meet you.
You too. So what can I do for you?
I'm ready for a nose job.
Okay. So what don't you like about your nose?
I have a big nose. Kind of a hump here, and it's really, I don't like the fatness of it. I'm just kind of ready for that.
Okay. Yeah. And have you ever broken it, or is this the nose you're born with?
No breathing problems, never broken it. I just don't like how it looks. A lot of people mention it, and if they're mentioning it, it makes me feel uncomfortable.
What's your ethnicity?
I'm Hispanic.
Hispanic, okay. Is this your family nose?
You know, it's not. I mean, both my mom and my dad don't have this nose, so I don't know where it came from.
Okay.
And that's why I really don't want it.
All right, very good.
Yeah.
So I see the bump from the side, it's kind of large, the bulbousness to the tip. Is there anything else about it that you don't like?
It's kind of just protruding out, but other than that, just like the roundness of it, I really don't like.
I assume you want something natural and subtle and masculine.
Yeah, exactly.
Just make it look like you, just a little better.
Exactly. I don't like people standing next to me on my side. I prefer them head on, just because I feel like you can't see the big hump.
Look straight ahead, please. Good. Smile real big. Good, relax. And when you smile, it even has more of a downward appearance to it.
Yeah.
Right? Yeah, and it's quite projected and quite large there.
In social situations, I feel confident. I'm okay with the way I look. I just really feel that having this procedure would make it look better.
So what I'm looking at now, I'm just looking at your septum just to look at the inside, just to make sure it's all straight, and it's all straight and intact. Everything looks normal in there. I'm just making sure you don't have any deformities inside and that your breathing looks okay, and it does. Everything looks pretty good in there, okay?
Okay.
Okay, so we're gonna go onto the computer. I'm gonna show you everything. You're a great candidate. I think you'll get an amazing result. I use the computer as a tool where I can make changes and show them what their nose will look like when I'm done, making it smaller, making it bigger, lifting the tip, dropping the tip, whatever it is we're going to do. It makes much more sense to the patient, and they walk away with a much more thorough understanding when we've looked at the same picture, rather than me just telling them, hey, this is what I want to do, where they're not seeing the same thing. So I've converted to this method of examination and evaluation, and I'll never change. It's perfect, and it works beautifully every time. Yeah. It'll be completely natural and masculine. Nobody will ever know or suspect that you did anything.
Yeah.
No, they'll just think you were born with that nose.
Very natural, yeah.
It'll just look like the nose that's supposed to be on your face.
Okay.
Okay?
Let's do it.
All right, come on.
All right.
Skin.
Hey, Reuben.
Doctor, how you doing?
Good morning.
Good morning.
So first thing in the morning, I like to come in, try to relax the person as much as possible, and then I like to review their photos with them. I want to make sure we are on the same exact page with no chance of miscommunication. I know exactly what we're going to do, but I want to hear you tell me to make sure we have no miscommunications.
Sounds good.
What do you want your profile to look like?
Just straight.
Yep.
No curve, no nothing,
Good.
no dip.
Let's look at the front view.
Right. Just kind of narrowing the bridge on this side, and then just bringing it in a little bit at the tip.
Yep.
Yeah.
Perfect. Well, you hear about significant miscommunications in medicine all the time. So I put in 120% effort to make sure that never happens. There is that large of a menu of noses that Reuben could have that if we weren't on the same page, there wouldn't be a chance for him to be happy. There's no such thing as an easy rhinoplasty. They're all complex. But as far as rhinoplasties go, this is not what I would say is a complex rhinoplasty.
Okay.
Within certain limitations, I could do almost anything I want with a given nose. But on him, I want to make sure I'm doing what we agreed to.
And these marks that you're putting, is this what's going away?
The marks that I'm making here show me the confines within where I'm going to reduce the height.
Okay. Right.
All right, my friend.
Let's do it.
I'll see you back there in a few minutes.
Okay.
All All right, bud, so pick out a good dream, okay? We're gonna get you some medications, you're gonna go off to sleep, I'll be with you here the whole time, I'm gonna take great care of you, okay?
Thank you, doctor.
You'll get an awesome result. So Reuben will be under general anesthesia, so as he's going to sleep, we say some final words so that he's left with some positive reinforcements, and I think it can only help to have that said to him while he's going under. In general, I believe the psychological component is an important component to good healing. Asleep, so we're about to get started. Really nice guy. I know he's saved up for this for a long time, so I'm gonna do everything I can to give him the perfect result, and I think he'll do just great. All right, guys, ready? Step one, I'm going to prep the nose, which means I'm going to inject it with local anesthesia, place some Afrin on the inside just to shrink down all the tissue, which will make my visualization maximized. So step two, I'll make an incision on the inside of the nose and I will evaluate the full extent of his septal cartilage. I'm going to dissect out the septum, which is the cartilage on the inside, because I need to use that cartilage to support his nose once I get everything opened up. Step three, I open the nose, which will allow me to visualize the entire extent of his nasal anatomy. Boy, this is unusual, I gotta tell you. See that little nubbin right there? Boy, oh boy, this is tricky. When I opened Reuben's nose, I encountered very weak cartilaginous anatomy. And this guy has what's called a tension nose. What a tension nose is when the bump of the nose sets the tip position, meaning the reason his tip is where it is because the bump is holding it up, because the tip has no support. The tip isn't holding itself up, which means you have to recognize that, because if you bring the bump down, all of a sudden the tip will go down and smush down because it's got no support. Step four, I reduce the height of the bump. I use a specialized file that's designed to bring down the bony component to the hump. Step five, I remove the piece of septal cartilage that I need to add back into his nose. Step six, I refine the tip by removing the excess cartilage that I don't need and then using sutures to reshape the tip cartilages into a very nice configuration. Step seven, I narrow the nasal bones from the frontal view. This will give a refined appearance from the front once I put the skin back down. Step eight, I make my final adjustments by placing little pieces of cartilage in certain areas just to create nice shadows to give the ultimate refinement. Step nine, I close the nose and suture it closed. Put the dressing on and we're done.
I really like what I'm seeing.
The 12-month mark for the final photographs.
All right, thank you. I appreciate it. I'm very glad that I got liposuction because I can already see the results.
It's been 1 week since my surgery and I'm feeling really good. Getting ready to get the cast off, yeah.
Okay, let's take a look.
All right. I don't know what it looks like yet just because the cast is still on.
I'm gonna put a little of this adhesive remover on your skin. I spend 15 to 20 minutes removing that dressing so that I can separate the tape off of the nose without pulling the skin of the nose off the underlying cartilage. Surgery was actually very, very complex. Okay. It was actually very difficult. I had to do some extra strategic maneuvers. The main issue was your nose was very weak. This can give somebody the self-confidence they've always dreamed of. It can make somebody comfortable asking someone out on a date. This can change the way somebody feels about themselves completely.
This surgery meant a lot to me and I'm really excited that it's finally happened.
Definitely knows that required every bit of skill and experience that I have.
That's what came to you.
Your nose should look great the minute we get this cast off. One of the most rewarding parts of my job is that moment where I remove that nasal dressing and I see the result of the nose that I've created. Rhinoplasty is such an artistic endeavor. Oh my God, Reuben, this is awesome. This is exactly what we drew up. And when you see your vision come to fruition, it's just the best. Okay, you ready to see it?
I'm so ready.
Yeah, all right, here we go. Take a look.
All right. When I first looked into the mirror, it was a little scary.
Get a shot of that profile there. Can you see that?
Yeah.
I'm very pleased with Reuben's nose. So we have just a little bit of swelling up here. You're a little bit full right through here. That's all going to go down. And from the front view, it's just a little bit full in width right throughout the whole length of it.
Yeah.
The final result for rhinoplasty takes about a year. But if I've done my job right, even at 1 week, that person will be happy.
So excited. Thank you so much. Cast is off, stitches are out, and I really like the results. I'm really happy with it.